Welcome. If you are here for the 7th annual Crossover Healthcare Ministries Spring into Action event, you are in the right place. We're glad you could join us for this live program. My name is Betsy Beamer. I'm a member of the board of directors and I'm your MC for this afternoon. We know you could spend your time in a lot of ways, so we really appreciate that you've chosen to spend it with us. If we were in person for this event, we would most likely be getting ready to share a meal and have a blessing. So if you'll just bow your head with me, please. Heavenly Father, we are grateful for this opportunity to share about Crossover. We ask that you bless our patients and our families, and also our staff and volunteers who serve them. In Jesus' name we pray, amen. We couldn't start the program without thanking a lot of the people that are responsible for what we're doing today. First off, our planning committee, Helen Nunley, Janet Wills, and Becky Bynum. We so appreciate their help, and we also appreciate all the behind the scenes things that our staff has been doing. We also want to recognize the sponsors that have generously given to this event: Aggie and Richard Cullen, Carey Street Partners, Kelleher HVAC, Patient First, Wills Financial Group, also Janine Collins, Gigi DeBlois, Helen Nunley, Judy Collins, and Joe Teefy, Rebecca Bynum, and in kind from Eventful, who was really behind the scenes with this, crossing the T's and dotting all the I's. Our topic today is not just important to Crossover and our patients, but really to all of us, and it's the impact of COVID-19 on our children's mental health. The heart of our program today is a panel from local providers here in the Richmond area to talk about the impact this has had on children and some tools that we can use to help them as we move into the new normal. But first, allow me to introduce to you our CEO, Julie Bilodeau. Julie has a BA in economics from the College of William and Mary and an MBA from the Darden School at UVA. She started her career here in Richmond in corporate planning at Circuit City, stayed home for a while with her 2 little boys, and then fortunately for Crossover, she joined the nonprofit world with us 17 years ago. During her tenure, we have grown to be one of the largest charitable clinics in the Commonwealth, if not the largest, and we serve 6,000 patients annually at our 2 clinics. Please welcome Julie Bilodeau.
Thank you, Betsy, and good afternoon, everyone, and welcome to the 2021 Spring into Action event. So a little bit about the services at Crossover. At Crossover Healthcare Ministry, we provide integrated, comprehensive medical health care to folks who have difficulty accessing medical care. And we provide this care at 2 health centers in the Richmond area. Our Richmond clinic is located in the Manchester part of Richmond at 108 Cowardin Avenue. And we also have a second health center opened in 2005, close to Regency Square in Western Henrico County at 8600 Quioccasin Road. And a little bit about the scope of services that we offer. Crossover provides comprehensive integrated health care. So we do provide primary care. We provide pediatrics and primary care for adults. We also provide subspecialty care, over 15 subspecialties such as rheumatology, cardiology, orthopedics are also offered to our patients. We offer prenatal care and we offer GYN care. We offer HIV testing, and we also offer full treatment for HIV. We have 6 dental chairs, so we offer dental. We offer ophthalmology. As you'll hear a little bit about later, we offer behavioral health, and we also have a licensed pharmacy on site at our Richmond clinic. And our patients really fall into 2 buckets. Our patients are low-income uninsured, and starting in 2019, we began also serving patients who are enrolled in Medicaid. And I wanted to do a quick shout out to our nursing team here at Crossover. We really have an amazing employed nursing team that is assisted by lots of volunteer nurses. But I wanted to give this team a shout out because this team has really been at the forefront of our response to COVID. When COVID hit us last March, it was really this team of amazing folks who stepped up and took on COVID response in addition to their daily responsibilities in our medical clinic. And since March of last year, we have become a testing site for crossover patients and the community for COVID testing. And we've done over 2,500 COVID tests. And in addition to that, back in January, we actually received our first shipment of COVID vaccine back in January. And since then, this team has led the charge, and we've administered over 1,600 COVID vaccinations. And so this is just an amazing team, and I wanted to say thank you to them publicly this afternoon. So thank you. And so, as Betsy said a little bit earlier, we provide our healthcare services to just about 6,000 individuals in Richmond. But really, to bring kind of home the scope of what we do, I thought I would tell a story about Sophia this morning. And Sophia is a patient at Crossover who fled Latin America due to an abusive marriage, and she came to the United States. And so Sophia is low income, and she has been in distress. And Sophia does not read or write in any language. And not only that, Sophia is a single mother to 4 children, aged 5, 8, 10, and 17. So just imagine for a moment coming to the United States, not having any resources, unable to speak the language, unable to read or write in any language, and being the sole caregiver for 4 minor children. And that is the situation that Sophia was in. And so Sophia came to Crossover, and we were able to provide the healthcare services that I just listed. But I think what is truly amazing about Crossover is that we were able to go beyond that for Sophia. So Sophia worked with Melissa, who is a social worker here at Crossover. And working with Melissa was able to help Sophia get all of her children enrolled in school. And then Melissa was able to work with her to help her understand the school system and the forms that she was getting, because she wasn't able to read or write any of the information that she was getting from the schools. And so then, of course, COVID hit, and children were learning at home. And as you can imagine, Sophia did not have any of the equipment that was needed for her children to learn virtually at home. So we were able to help Sophia navigate that and get all of the equipment that was needed for her children to be able to do virtual learning at home. And then we were also able to help her navigate the free lunch program so that her children had healthy food to eat. And then finally, as many of you know, we have a holiday family program where we help our families with holiday presents, food cards, things that can really enrich their holiday. And so Sophia's family was able to benefit from the holiday family program. And so, all of the resources came together. We really wrapped our arms around Sophia and her family and provided a lot of care that goes beyond, I think, what we typically think of as healthcare. And so, unfortunately, Sophia's story is not unique at Crossover. I could tell many more stories of patients who have received this kind of care that enabled their family to function and flourish. But what I would really like to do next is introduce a short film that will really introduce you to the amazing mental health team and social work team that enables Sophia and patients like Sophia to receive this level of care at Crossover.
I would say that the pandemic has had a significant impact on people's mental health and wellness. What I've seen in my patient population is that individuals who already have pre-existing mental health conditions, those conditions have worsened due to the effects and the stress of the pandemic itself.
In the past year since the pandemic, I have seen a rise in depression. I have seen a rise in anxiety. Just related to the situations that are happening. I have seen families just go from having to not having at all. Families just feeling like, what are they going to do the next day?
So this past year was especially challenging for our crossover families who have students. There was quite a learning curve, literally, in helping them adjust to one day hearing that school was closed for 2 weeks and then essentially being closed for the rest of the year.
The beginning of the pandemic, before March 2020, we would receive 600, 700 calls a week. And now, April 2021, we have been receiving 1,500, 1,600 calls a week.
I think that social work is integral with healthcare. In the social work profession, we operate from something called the biopsychosocial spiritual assessment, in that we're taking into account all of these areas when we work with our patients. So the patient who might be sitting in the office in an appointment with me is not the end of the patient that I help with. If that patient is married or has children or extended family or is having trouble navigating the systems in the community, social work can help with all of that.
We have integrated care here at Crossover, and what that means is that the medical team and the mental health team and all of our specialties in social work, we all work together to kind of work around the patients and kind of provide a circle of care with the patient. Recognizing that we aren't just, bodies, we're also minds, is very important in how we treat the whole person.
Everybody had to face the unknown with the pandemic, but if you consider what it would be like to be pregnant in the midst of that unknown, that's a lot of added stress, because it's not only yourself that you're worried about, but your unborn child. I think the OBT team was really innovative in the way that they came up with a hybrid telehealth and in-person visit schedule, so that we were minimizing how many times our pregnant patients had to come into the clinic, be in contact with lots of other people, but at the same time we were able to maintain continuity of care throughout their pregnancy and see them in person when they needed to be seen the most.
Before the pandemic, patients would miss appointments, and when we'd ask them why they missed appointments, they would be like, oh, I couldn't get a babysitter, or I didn't have gas money, or other barriers. And by converting our services to telehealth, we actually have removed barriers for clients, and clients have been able to get services on a much more flexible schedule in a way that works for them. There is not one particular patient profile or one particular type of patient that is likely to need mental health services at Crossover. The need for mental health services can't be, split down by gender or race or age. All patients at any point in time could need mental health services at Crossover.
They should know that there are resources out there, that even when they're going through the worst of situations, that we are here to help them, that Crossover is here to help them.
So thanks to Crossover, rent has been paid, food has been served at home, students have had access to the internet and laptop devices in order to attend school virtually. For me, the biggest role that social work has been able to play here at Crossover is to be an advocate, to give a voice to our families who otherwise wouldn't have been heard and whose students might have been completely left behind this year.
We really focus on relationships with our patients, and that puts us in a good place to be able to provide mental health care.
Crossover is hope. In a time where hope has been lost, in a time where people just don't know what to do, I think that we have been like a beacon of light in the community.
Crossover is here to help.
We are so fortunate to have these clinicians and caregivers here at Crossover to give this type of help to our patients. They not only provide education but encouragement and true support and hope. And that's what we all need. So how does all this come to be? Well, it comes to be through grants and corporate giving and individual donations. So while there was no cost to this event, we hope that we are able to show you today that crossover is worthy of a contribution as the program unfolds. I'm pleased to share to date that we've raised $44,300 and actually we're up to $391 toward our goal of $55,000. It's important that we tell you where the money goes, and it goes to two things. Always goes to the compassionate care of our patients, and then some money from this particular event will go to renovations of our Richmond clinic that's down in the Manchester area of Richmond on Corden. These renovations are so necessary to provide better and more efficient space within our four walls, while at the same time renovating the outside to reflect the dignity of care that we give within. So if you like what you're hearing and seeing today, I invite you to make a gift to Crossover during the program. We've tried to make it easy for you by texting Action 2021 to the number 41444. You see a Kate Spade bag there. That's an added incentive. We had a couple of folks donate two Kate Spade bags to us. One will be given to someone that pre-registered before the show, and then also someone that contributes during the event. Both of these winners will be chosen following today's program, and we'll send out an email to those two winners. So now to our program and why we're really here, and we're so looking forward to hearing from these women. Joining us today are three experts in the field of children's mental health right here in the Richmond area. First, Shanae McCrae. Ms. McCrae is a licensed clinical social worker and currently serves as the Chief Operating Officer for Mental Health Services at the Richmond Behavioral Health Authority, where she's worked in various roles for more than 18 years. Ms. McCrae has been instrumental in implementing same-day access and permanent supportive housing among the mental health programs, and she's looking forward to expanding access to school-based mental health services. Also today, we have Dr. Carla Schaefer. Dr. Schaefer is a licensed clinical psychologist in private practice and specializes in the treatment of anxiety and related disorders in children, teens, and young adults. Dr. Schaefer also serves as clinical supervisor of graduate student clinicians in integrated primary care. And last but not least, our own Shaliqua Thompson. As you saw earlier in the video, Ms. Thompson is the Behavioral Health Program Coordinator for Crossover Healthcare. She's a licensed professional counselor, a nationally certified counselor, a board-certified tele-mental health provider, and she recently became certified in clinical trauma treatment. Ms. Thompson specializes in treating depression, anxiety, and trauma-related disorders in adolescents and adults. Before we jump into the panel discussion, I want to let our viewers know that if there's questions being asked if there's questions not asked that you're interested in, please type them into the chat box and we will allocate some time at the end of the program to answer those. So here we are, let's dive right in. I guess I want to start out with asking the question of what were the most frequent challenges experienced by children before the pandemic began?
Good afternoon, everyone, and thank you for having me. I would say that the most frequent challenges experienced by children before the pandemic are wide-ranging, but most commonly around mental health or depression and anxiety. I would also say that it occurs more frequently around children in the adolescent years. That we know that in the day and age of social media, society's pressures around seeking perfection weighs heavily on a youth. When a youth hasn't developed their sense of identity and who they are, they're in a critical time period of trying to find their peer connections, deciding who they are within their world, and sometimes receive external pressures from society. And so I think that puts a lot of pressure and strain on young people. I do experience at RBHA, we experience a lot of youth who are seeking services experiencing depression, some anxiety, even having thoughts of suicide.
What has changed as a result of the pandemic?
Well, I think Ms. McCrae summed it up nicely in terms of what, kids were struggling with before. And I think a lot of those things still exist now. So while there is some change, there's also some things that have remained the same, but then you have the added sort of stressor of this pandemic that nobody was prepared to deal with, in fact. And so, social isolation has created more difficulties for some kids. Being out of school, having some decreased stressors could be actually helpful, maybe reduce distractions. But on the other hand, for some kids, maybe they relied on sports or after school activities to help them cope with things that all of a sudden they don't have. And so I think what I've seen a lot of is almost, and I think this was Ms. Thompson kind of mentioned this in the video, but if there was already something, it was heightened. It's more, more intense anxiety, more intense depression, maybe even self-harm, and things like that.
Yeah, I would add to that here at Crossover, all of those things previously mentioned really do apply, but also kind of are exacerbated by the roles that the children have to play in their own families. Oftentimes, the children speak better English than their parents do, and they spend a great deal of time having to interpret or having to take on these what I would consider to be really adult concerns, like having to call in a prescription or having to help their younger siblings with online school or calling, Comcast, the cable company, something like that. So I was working with an adolescent the other day, and they said something to me. They said, I don't really get to have a childhood. And I think that's a very common experience for our children here in our patient population at Crossover.
What would some of the warning signs be that parents should look for regarding their children's mental health?
I would say the way I like to think about this is kind of from two different perspectives. One is emotional and the other is behavioral. I would say that parents, by nature of being the parent and being around their child the most, they know who their child is. And so if they notice any type of change, particularly changes like in emotional expression, like, mood swings, excessive fear, worry, nervousness, nightmares, temper tantrums, concentration difficulty, anything that seems like there's just this excess of emotion kind of out of nowhere, I think that could be considered a sign to look for. I also think, maybe some behavioral issues, school changes in school performance, disinterest in activities, changes in sleep, changes in eating habits, withdrawing, and also among like adolescents, any type of substance use, drug or alcohol use. These are things that I would say, you kind of want to look for these things just to kind of see if there needs to be any type of help offered to the child or adolescent.
Are there any particular behaviors that would require getting your child immediate assistance?
Yeah, I think definitely anything that seems to be some sort of self-harm, whether, we do have somewhat of a distinction between self-harm with the intent to actually commit suicide and self-harm to just kind of cope and deal with stressors. And either of those, honestly, just self-harm in general is something that should be considered an urgent matter and something that should be paid attention to and getting providers involved. But I think there can be other things too. So kind of echoing, what Ms. Thompson had mentioned, if there is, maybe even an increase in difficulty sleeping, difficulty eating, and where it's something that's persisted. So not just necessarily like a week off and on here and there, but it's something that's been now happening for several weeks at a time. Even if it doesn't feel like an urgent issue, but it's been occurring for a while, it's something that should be also then looked at.
not being able to read a child's mind, what are some things parents can do to support our children's emotional and mental health?
I think it's important to help children identify their feelings. I think that when children are very young at that age, they may not be able to put a name to how they're feeling. And so that's something that should be taught and help them to accept that, if they're feeling angry or they're feeling sad, to help them put a name to that. I think it's also important to validate your child's feelings, that when they are feeling sad, and especially in a pandemic, sad or isolated or missing their friends, to validate their feelings, to understand that young people need connection to their peers. That's how they develop as a young person and they evolve into the person that they're going to be. And so it's very important to them. And so helping to validate their feelings, I think, are important. I would also say to help them regulate their emotions, I think is something that is very critical, that we all learn at a young age to regulate our emotions. When we are expressing anger, what's the healthy way to express anger? When we are experiencing sadness, or we are experiencing any type of emotion, what is the healthy way to express that? And I think that that's a way that we promote very healthy and positive mental health and emotional well-being.
Ms. Thompson, how do you encourage your patients in the fact that it's okay to have mixed emotions from one day to the next and being confused through all that?
I think like what Ms. McCrae was saying, validating and helping to identify feelings is really important. One thing that always strikes me is that we have a lot of words to describe feelings, but we don't often learn all of those words until we're much older, right? So most people can identify some basic feelings like happy, sad, disgust, angry. But, what about some of those more nuanced feelings like resentment and remorse and regret, and some of these kind of feelings that kind of grow within all of us that can kind of be mixed. But if we're not given the language to communicate the feelings, and if we're not supported and validated in those feelings, I think it makes us feel very strange and very abnormal. And I think it's really important for us to recognize that this is perfectly normal to kind of have all of these feelings. Feelings come, feelings go. They're like waves in the ocean, that we're always having them. And learning how to manage that wave and how to kind of integrate that into your life experience, I think is really important. So that education is given, but also modeling that behavior is really helpful as adults, because we can all be supportive adults to children, and us kind of, showing that it's okay. We have mixed feelings too, I think is really important.
Are there certain strategies to help children and teenagers who are more introverted?
I think I wanted to just kind of echo what Ms. Thompson had just mentioned before we get to this question, which I think, Ms. Thompson, you put it so well, that, big emotions are so natural and normal, and being able to see it as a wave. And I think sometimes parents also might hesitate to have those conversations if they themselves don't really know how to express big emotions or really talk about it. So one thing that I work with my parents a lot on is just listening. Like, there's a lot to just the art of listening, and not necessarily having to have the answers, not necessarily needing to know everything or how to solve the problem, but just being able to sit with their child and let their child feel comfortable speaking, is one of the ways that parents can really connect with their kids and let them, talk about emotions. And then in terms of children who might be more introverted and getting them to really engage, I think that we often see extroversion as a bigger strength than being introverted, but honestly, there are strengths in both. And so being able to see that, introverted children might just relate socially differently, and they might need more time on their own to sort of recharge, and then they can engage with other people. So first seeing like, what are these child's needs, and what do they need in order to feel more comfortable engaging with other people and engaging with support activities. And maybe support activities for them might just be going out for a walk with a parent, or going to the store, cooking with a parent. So not necessarily even how do we get them to be more extroverted with peers, but how can we just get them more engaged at home, and then they have some level of confidence in what they can do.
In terms of, I think each family has to decide their comfort level of going out and getting involved in other activities like sports or church run activities. Is there value in trying to involve our students in those type of activities?
Absolutely. I think that it's critical as much as we can help our youth to get involved in any type of activity where they're able to explore, they're able to see different parts of their community, other views and different cultures, but also be with other people. So I do think that there's value to be able to translate some of those skills that they've learned at home, to be able to use those in the community in various settings. And sports, church, projects or things with the school are very safe ways and safe places to be able to use those skills.
You know, a lot of students have been in school and a lot of students have not been in school. So how can we best support our children during the reentry process to school in the fall?
Yeah. So I think this is the answer to this question does require some thought and preparation on part of the parent, depending upon whether or not the child has already been in school. Maybe they don't need as much help with kind of transitioning back to being in school in the fall, as opposed to if the child has been virtual the whole time. I think there would need to be some conversations had about, okay, so this is kind of what your school is doing, because I think one of the complications for me that's been difficult trying to support all of my students that I work with is that each of the school systems are doing something different. And so it's a very individualized answer, or at least they had been doing something different, but there was just so many changes so quickly. And so I think first the adults have to be aware of what the change is, and then talk to the child about, hey, you know, this is what the change is. How are you feeling? You know, normalize and validate whatever the feelings may be. And then maybe also talk through some strategies about how to kind of put a routine in place that works for the child, or put some structure in place to kind of support the child as they transition back to school. Okay. And that's, I think those two things, you know, working on the feelings and working on the structure are kind of, you know, two really good strategies to begin to support them as they move back to in-person school.
And in terms of virtual school, you know, right now, and the isolation that the students have by really just seeing a screen for hours on end during the day, how can we support them during that isolation that goes on for so many hours?
You know, I think that getting kids into having them have a routine is important. So even if they're virtual schooling at home, having a routine, kind of an idea of I get up in the morning and then I am still moving out of my space, out of my bedroom, out of my home into the more virtual schooling environment. I remember reading early on in the pandemic about one of the ways to just adjust to the virtual living was to get up in the morning and go for a short walk and then come back home. And in a way, you kind of start that routine, that schedule going. So having them on a routine and having them just checking in with them throughout the day. So maybe trying to have a lunchtime together, a snack time together, or something where you touch base, see how things are going. And it does require a little bit more on the parent side. But if parents can do it, then it's good for parents too, because they're getting up, they're being able to spend time with their kids as well. So, you know, I think the isolation is a real thing, and we can't necessarily change that with virtual schooling. But what we can do is increase some interactions and movement, even getting kids up and moving around.
All right, and what is the role of like extended family members, grandmas, grandpas, cousins, aunts, uncles, in this entire process with children's mental health?
I'd say that the role of extended family member is very crucial. In the work that we do every day, we always want the natural supports of a family or an individual to be involved. We also want family members to understand the child and some of the experiences that they're having, how they're feeling, and be able to validate and support that child. I think also it's important for extended family members to support the parent or the caregiver. Many times, I think we often focus on the child and may sometimes forget about the caregiver and some of the emotions that they may be experiencing, some of the things that they may be going through. But many times, an extended family member could be a big support to the caregiver. So I think that that's important as well.
Great. I would want to remind the audience also, if you have any additional questions, please use the chat feature at the bottom of your screen. Would be happy to throw any more of these out. And I guess one other quick question I had was when Ms. Thompson was talking earlier about telehealth. Do you think that's as effective as in-person services?
I do. There's been a great deal of research about how using telehealth as a service delivery model greatly reduces barriers and it allows people to engage in care more effectively in a way that works for their life, but also the outcomes are the same, meaning that if, for example, if someone were to receive a course of depression treatment in an office in person, and then if you took that same depression treatment and you compared it to being received through a virtual medium, you're going to get the same results. And so that's very important. And I was thinking about this the other day. I think the younger generation is much more engaged in their technology and on their phones. And even at times, I have a hard time keeping up. I've had to have them explain things to me a number of times since the pandemic started. And so I think for that population in particular, telehealth is going to become a more and more popular way of kind of engaging them and getting their needs met, just because it very much is kind of integrated in the way that they communicate and socialize and interact with the world.
Very good. I think we may have a question that's coming in from the audience. Are you seeing more or less emotional problems in a certain age group? Is there an age group that stands out?
I wouldn't say that they're, from the perspective of the youth that we serve at RBHA, there isn't a particular age group. I would say maybe the largest struggle may be in maybe middle school, if I had to choose, but we see it across the board of isolation, family problems that are impacting the youth. Many of our families have a caregiver that is now unemployed, or the opposite, that they are employed, and so there's lack of supervision. And so that contributes to some emotional challenges that the youth may have. But I will say, if I had to choose, the middle school age group has the largest struggle.
I would agree with that. In my private practice, I do a lot more of anxiety and OCD, and I definitely have seen more of an uptick in the middle school population, just having more difficulty with that and needing more support.
All right, another question from our audience. My child is about to turn 11. What are some important ways to support children's mental health as they enter adolescence and middle school? Back to the good old middle school.
I would say that the some of the important ways would be, again, to help them identify their feelings, to help them understand what they may expect going into middle school. I think middle school is a huge change from elementary school. That there's a little bit more of independence, there's a bit more higher expectation, and so talking with your young person about what they can expect. Maybe also getting some feedback from them about what they're excited about. What are some things that they are nervous about? and talking that through with them, I think is important.
All right, I think we have perhaps one last question. I have a toddler in daycare. Her teachers wear masks. Is my child missing out on learning facial and social cues due to masking?
I can't quite say one way or the other about that. I haven't seen any studies about that or any research in that topic in particular, although I certainly can see where the concern would come from. Dr. Schaefer, Ms. McCrae, do either of you have anything to add to that?
Nothing research-based. I can speak from my own opinion or ideas on it. That it's a really good question. And like Ms. Thompson mentioned, we can kind of see where that concern might be coming from. I think when we think about all the things that children have had to adjust to with the pandemic and mask wearing and just things being so new, on one hand, we can focus on, okay, what are they missing? What are they missing out on? What are they not getting that I got when I grew up? But on the other hand, these children are showing so much resilience. And I personally probably underestimated how well they were going to be able to adjust to even, the pandemic in general. So my guess is that even with, the concerns about people wearing masks and maybe not reading social cues now, I think these kids are going to find a way to still be able to adapt and still be able to just be resilient as they move forward.
I agree with that, for sure.
All right, well, thank you all so much. Ms. McCrae, Dr. Schaefer, Ms. Thompson, your expertise has really helped us out this afternoon. We know you're busy and we appreciate you taking the time, so thank you.
Thank you.
Thank you for having me.
So if you feel like you have learned something helpful today, we invite you to join us in our mission of bringing compassionate care to the uninsured and the medically underserved neighbors in our area by donating today. As you heard from Julie earlier, it's a comprehensive health clinic. The first time I went in, I had no idea what I was walking into, but it, again, is primary care, eye, dental. You saw Dr. Avula. It's also OB/GYN care. It is COVID vaccinations and COVID tests and just everything that we can do to support the community. So to make your gift today, you can text Action 2021 to 4144. We are inching up towards our goal. Every step gets us a little bit closer. Also, remember, please, that we have a Kate Spade bag out there that may just have your name on it. If you prefer to make a donation by check or a donor advised fund or another method, please reach out to Misty Procious, who is the development associate at Crossover Healthcare, and she's just MPROCIOUS at crossoverministry.org. I can see that donations are coming in. Looks like we're up to 48,613. Diane Joyce, Susan Lee, Hillary Winkleman, Robin Yager, Miller Roca, Mary Ellison, thank you all so much. Jenny Boland, Jody Day, Elizabeth Long, Laura Grammer, Marilyn Whalen, Maria Curran, Teresa Gonzalez, Karen Marcus, Cassie Lewis, Chris Bonner, Helen Nunley, thank you so much for your gift. Leanna Little, Rochelle Aholtz, Jan Murchie, Martha Anderson, thank you all so much. Helen, your gift of $1,000 is so appreciated. Do we have anybody willing to match that amount? And there I see Don and Pat Seitz. Thank you so much, so very much for this. While you're making your gift, I'd like to share with you a short message from our patients here at Crossover.
Crossover has changed my life.
El crossover ha cambiado mi vida.
Crossover غير حياتنا كثيرة.
Crossover ha cambiado mi vida.
Crossover changed my life.
Crossover ha cambiado mi vida.
Crossover غيرت حياتي.
Gracias, thank you.
Muchas gracias, Crossover.
Thank you, Crossover. شكرا لكروسوفر.
Gracias, Crossover.
شكرا Crossover.
Thank you, Crossover.
I want to echo the words of our patients there on behalf of our board, of our clinicians, of our volunteers. We thank you deeply. It's only through your generosity that Crossover is able to be the healthcare home for our patients. I see a lot of additional gifts. Thank you to Jan Murchie for matching the $1,000. We so appreciate it. Continue to see these names coming through, and we are so incredibly grateful. Again, ways to give: text Action 2021 to 41444 to donate, or check there at the email address on the screen. Thank you again for joining us today, and we hope you found value and hope in the program you heard. It truly is all about giving hope. I have often said that as much as I love my children, I don't love them any more than the mamas of the patients down at Crossover. We're all one big neighborhood. We go to church together, we go to school together, we are in different stores together. And it's so important that we can provide healthcare for those who just don't have access to it. And I sometimes personally so take for granted all the things that I have. So it's a privilege to give, and it's a privilege to be able to be involved with Crossover and to MC this event today. Special thanks again to our panelists, Ms. McCray, Dr. Schaefer, and Ms. Thompson. To you, our guests, and our virtual table hosts. We couldn't come up with a better name than virtual table hosts, so that's what we made you. Following today's program, everyone will receive an email with some different links to different resources about children's mental health. Additionally, the email will include an invitation to join us for a virtual tour, again, of our clinics, May 24th at 7 p.m. We can't wait till we can open up our doors again to you, but this would be so helpful for you to really see your gifts at work. And last but not least, our Richmond Clinic will be celebrating its 30th birthday on June 11th, and we're going to have a drive-through event from 4 to 6 p.m. I'm very excited about it, and we are also using it as an opportunity. If you would like to drop off some school supplies, we're doing a partnership with the YMCA Bright Beginnings program. So again, on behalf of all of us, thank you so much for your gift of compassionate care. We appreciate you taking time out today, and please enjoy the rest of your afternoon.